Dear viewers, I am your Dr. C. Jagadesh Reddy, Cataract, LASIK and cornea surgeon at Pristine Eye Hospitals, Hyderabad. Today we will discuss about the trending technology used in cataract surgery. Over the years, cataract surgery per se has evolved significantly. I am proud to say to be in this era where the precision of cataract surgery has improved enormously. Technology helps in detecting early disease, helps in planning a surgery better, helps in performing the surgery with a precise manner, and finally giving the desired outcomes that every patient expects. Technology also improves the safety of everything that we do on a day-to-day basis. Let's look at how technology is used in planning for cataract surgery and perform a cataract surgery. To start with, we need to detect a cataract. Any ophthalmologist who sees the patient in the clinic can detect a cataract if it is significant enough. But what do we do when we have very early cataract that cannot be seen with the eyes? So we have technology like the Pentacam AXL wave that Pristine Eye Hospital has can pick up cataract by measuring the quality of vision aspects like the optical imperfections or ocular aberrations. Any change in these ocular aberrations can worsen the quality of vision. That can be an early indicator of presence of cataract. The same device also has something called dysfunctional lens index or DLI index, which also is an indicator for detecting early cataracts. There are patients who have symptoms which do not correlate with what clinical findings we see as an experienced surgeon. That's when the technology like this will help us detect cataract early and help patients by performing a cataract surgery and improve their vision. Once we've detected cataract, the next step is taking measurements for the cataract surgery. The measurements are the most crucial aspects in the planning of cataract surgery because based on these measurements, we implant an artificial intraocular lens. In earlier days, we were doing measurements using contact methods. I would say as of today, the precision of the results have increased significantly. The predictability of outcomes is enormous because of the measurements. At Pristine Eye Hospitals, we use an optical biometer, which is a non-contact method. This will help in getting all the measurements without any contact with the eyes. This is very precise and this is the gold standard of care as of today. The optical biometer uses a laser interferometry that improves the precision. We also perform a tomography from Pentacam AXL wave that measures all the parameters that the optical biometer measures and also gives additional information to see if a particular eye is suitable for any of the lifestyle modifying intraocular lenses. Not all will be suitable for these lenses, but measurements can guide us in giving information so that the surgeon can take a call whether implanting these lenses is more safe for these patients or not. We do not want patients to be unhappy after surgery, so pre-op measurements are crucial for every patient. We also use technology to identify if there are any other diseases in the eye apart from cataract. Like we rule out the presence of dry eye, we look for this very meticulously, and we also look at if there are any retinal pathologies in the eyes, so that we don't miss anything before surgery and make sure patient gets what he deserves or what he wants after the surgery. One of the important aspects of planning for cataract surgery after the measurements are done is picking up a right intraocular lens and the power of intraocular lens. At Pristine Eye Hospitals, we would say for the last several surgeries, we've been using artificial intelligence based intraocular lens power selection, and this has improved our outcomes enormously. These artificial intelligence based selection of intraocular lenses predicts the post-operative outcome. The data generated from these artificial intelligence based formulas is based on enormous amount of data and surgeries done across the globe. We also used online artificial intelligence based formulae that are used for calculation of orientation of toric intraocular lenses as well. This amount of planning is required to improve the precision of your surgery. When we come to surgery per se, as we discussed in one of our earlier videos about the advantage of laser-assisted cataract surgery, the laser has improved the precision of all the steps that happen during the surgery. The laser-assisted cataract surgery definitely stands out to be much better than the traditional cataract surgery methods. At Pristine Eye Hospitals, we are happy to share that we use an artificial intelligence-based laser-assisted cataract surgery to improve outcomes of every eye that we operate. We also use a Centurion platform for removal of cataract. That's the phacoemulsification technique, wherein this technology has the most advanced fluid-based system. This is called active fluidics. So whenever we operate in an eye, there is flow of fluid and exit of fluid. The technology that we use has sensors in it. This sensors gives automatic feedback to the fluid-based system, wherein the more fluid that goes out, the more fluid comes up. So there's a balance, so that the discomfort during the surgery for the patient because of the technology is enormous. The goal of use of this technology is to decrease the discomfort the patient has during the surgery. The active fluidic system allows us to set the amount of pressure that should be built in the eye, and we work around this pressure so that discomfort for the patient doesn't vary during different steps of the surgery. I'm very happy to see that a lot of patients at the end of the surgery are surprised to see that surgery is already over. As a surgeon, it gives me immense pleasure to give so much comfort to every patient that are undergoing surgery. The second most important thing during surgery is visualization. So whenever we do eye surgeries, we use microscopes to see to that the eye looks magnified for us, so that we can perform all the steps as required. At Pristine Eye Hospitals, we have one of the most advanced microscope that's called Luxor Revelia, and this is the most recent development in this field, and this helps in significant improvement in the visualization of everything in the eye, so that we can perform the surgery meticulously. Over the years, I have experience of using several microscopes, and I would proudly say this is one of the best microscopes, and this gives us a good visualization of different aspects of the eye, and the depth perception that it gives definitely helps us to modulate our instruments in appropriate place so there's no collateral damage to adjacent structures. This technology also improves significantly for quicker recovery of patients. I would say cataract surgery as of today is bladeless, bloodless, painless, stitchless, bandageless to give a quick visual recovery from day one after the surgery. So viewers, make a right choice to have your cataract surgery with a center with all the appropriate technology so that you see better after the surgery. Thank you.